everyone. It's Dr. Doni, and I'm excited you're listening in today. And I'm excited to introduce you to my really good friend and colleague, Dr. Michael Traub, who is a naturopathic physician of many, many years. He's going to tell us more about himself. And he's located in Hawaii, or I should say on the island of Hawaii, but has done so much for the naturopathic profession and for his patients and for me as a friend over the years. And so I'm so appreciative of him and so grateful for him to be joining me for this conversation today about sometimes those of us as doctors turn out to be the patient. And so Michael wants to share about his experience being a patient, especially after all of these years being the clinician, the expert in dermatology, the expert in oncology and naturopathic medicine. And so now he's here to talk about his perspective as a patient. So thank you so much for joining me today, Michael. I really appreciate it.
Thank you, Doni. I'm grateful to be here and grateful to be your friend.
Aw, I mean, we met each other, I think, soon after when I graduated from Bastyr University. And I think we met maybe in 2001 or two, but in New York City. And that was when you were president of the association, the National Association for Naturopathic Physicians, the AANP. And then after meeting you, decided to run for that board as well. And so we got to really spend a lot of time also on that level, working, in boards and working on legislative processes for the profession. And so, yeah, just so everyone has a little bit of sense of that. But tell us more, that was definitely not when you graduated from naturopathic school. You were like, now I'm like, oh my gosh, I'm at 21 years of practice. And then I talk to you and you're like, yeah, that was a ways ago. Tell us what led you to go to naturopathic medical school and, what inspired you to do what you do?
Okay. Well, I will gladly do that. And when I get to the point where we met, I've got my side of the story to share also.
Oh, please do.
So I grew up in Southern California, the son of a dermatologist, and my mother was a nurse. I was the oldest of 5 kids. I wanted to be a doctor like my dad. I didn't really think that I could do anything else, for a career that I might have wanted to do, but I didn't have the talent to do, like be a professional tennis player or be a rock star. So I went to naturopathic medical school. I went to University of California at Irvine for my pre-med. And the first year that I was there, a very pivotal thing happened to me in my life where I kind of fell in with a group of people who were very committed to nonviolence and were very committed to ending the Vietnam War and would go to anti-war demonstrations and try to keep them peaceful, because it was kind of a paradox where sometimes these protests would turn into violence where, what we really wanted was peace. And so along with that, we affiliated with a group from the American Friends Service Committee to do a nonviolence act of civil disobedience, blocking a ship leaving from a naval weapons station carrying arms to Vietnam. And we jumped in the water in front of that ship and tried to symbolically block it and intended to get arrested. And so we did. And so fast forward 3 years or so after that, I applied to medical school. And I thought that writing about, why I had arrest on my record would be of interest to the medical school application, committees, the admission committees. And I was very wrong about that. I think they were looking for somebody who was a conformist, not a nonconformist. And so I started looking for alternatives to conventional medicine. And I knew nothing about naturopathic medicine at the time. But I did find out about it and thought, well, this is interesting. It's more like the kind of medicine that I want to practice, where I can be more like a family doctor have relationships with my patient rather than get into the high-tech world of medicine. So I applied for the I applied for the naturopathic medical school in Portland, which was the only one at that time. This was 1977, and my interview consisted of the admissions committee trying to talk me into going to their school. So it wasn't as competitive as conventional medical school. And I think that my arrest was probably recognized as an act of, humanism rather than one of misbehaving. So it may have worked in my favor. Anyway, when I was in naturopathic medical school, I had a course in dermatology that was pretty pathetic. And when I graduated and became a resident, I wanted to teach dermatology because I knew that in teaching it, I would learn more about it. That's what kind of led me into the dermatology field. I wanted to be able to converse with my father about dermatology, intelligently. And so I wanted to understand it better. So that's what pivoted me into dermatology. But to back up a little bit, when I was in high school, I had really severe acne, which was kind of ironic because my dad was a dermatologist, but he sent me to his partner who treated me with everything in the book that they used in those days in the late 60s for acne, including superficial X-ray radiation that, wasn't effective, and they didn't really understand that it would result in a high risk for skin cancers later in life.
Wow.
And so after I graduated from medical school, I practiced in Portland for 4 years. And there was something seriously wrong with the weather there. And I was looking for a sunnier place to practice. And at the time, there were just 6 states that licensed naturopathic medicine. And only 2 of those states were in sunny places. One was Hawaii in the middle of the ocean. One was Arizona in the middle of the desert. And I'd grown up by the ocean, so I picked Hawaii. In 1983, I came to Hawaii and took the state board exam to get licensed. This was before we had national board exams. And then in 1985, I made a New Year's resolution that by the end of the year, we would be in Hawaii. I was married and I had a young son at that point. And in February, I got a call from a friend who knew of my desire to move to Hawaii. And he said, Michael, there's a doctor on the big island of Hawaii who wrote a book on natural medicine, and he wants someone to cover his practice while he goes on a book tour to promote it. So I called him up and I said, I'm your guy. And we came over and I started practicing here. So I grew up in Southern California. I've lived in Hawaii the rest of my life pretty much. And I've had a lot of sun exposure. So with that, combined with the x-rays that I had as a teenager for my acne, I started developing skin cancers around the age of 40. And they just kept kind of increasing as the years went on. And so I've had probably 40 or 50 skin cancers, a lot of them on my face. And in December of 2019, my dermatologist proposed giving me a carbon dioxide laser treatment for a small light brown lesion on my left cheek. That would look like here, but I'm seeing myself. And so it looks like I'm pointing to my right cheek, but it was on my left cheek. Mm-hmm. And I was uncomfortable with her just destroying this unidentified lesion. And I told her I wanted to have a biopsy because I'd had a friend recently pass away from basically having a chronic condition that was undiagnosed and later determined to be a cancer, and he had passed away. And so that was fresh on my mind. And so I didn't want to treat something without knowing what it was. And the biopsy revealed that it was a basal squamous cell carcinoma with perineural invasion, which means it's a combination of the 2 common types of skin cancers, basal cell and squamous cell. But it was invasive, and it had invaded the infraorbital nerve under my left eye. And there were no symptoms at the time, but that was kind of an ominous thing for a type of cancer that doesn't usually invade to be invading already into a nerve. So I had to go for a second surgery. And I went over to Honolulu for that and lucked out and had a surgeon who had performed the first successful face transplant in the United States at the Cleveland Clinic.
Wow.
And so I was in very good hands, but when he excised the rest of the lesion, there was still perineural invasion. So that meant that this was, it was a metastatic situation that surgery was not going to cure by itself. So I had to go through 30 sessions of radiation therapy. And before I did the radiation therapy, I had a baseline MRI. And after I finished the radiation therapy, I had a follow-up MRI. And the report initially said that it was my MRI was clear, but my radiation oncologist asked the radiologist to take a second look at it, which led to the radiologist making an addendum to his interpretation of the MRI scan when he saw that what he thought was metastatic spread to the brainstem. So this nerve, the infraorbital nerve, is a branch of the trigeminal nerve that goes to the brainstem. But if you have brainstem cancer, you usually have a lot of weird symptoms, a lot of involuntary motions and all kinds. You don't look right and you don't act right. So it didn't really make sense. So I was advised to get a second opinion. And I spoke with a Mohs surgeon who's an expert in dermatological surgery, and he recommended that I call a friend of his at Cedars-Sinai in Los Angeles. And so I sent him a copy of the MRI, and I heard back from him about 2 weeks later, during which time I had the opportunity to deal with the fact that I might be making an early exit from this life and, have kind of a dire prognosis. Mm-hmm. And a lot of my friends and family and loved ones were very concerned about me because I had this diagnosis of metastatic, cancer to my brainstem. And so everybody was all worried. I wasn't that worried. I don't know. I over the years, I think I've kind of developed a more philosophical attitude about death. It's not something that, terrifies me like it did when I was a kid and I didn't really understand it. And so at any rate, I was okay. But during those 2 weeks, I also searched for other options in terms of how best to deal with it. And I called major cancer centers, and a couple of them really were disappointing because they basically treated me like just another cow in the line. And I wasn't, given any extra respect for being a physician. And they wanted, just my insurance information, and there was no empathy, no caring. And so it really made me empathize more with some of the experiences that my patients have gone through with cancer diagnoses when they aren't really given the type of care that they deserve. Mm-hmm. And so that kind of has inspired me to take a more active role for my patients with cancer, especially, but all patients, to help them navigate the healthcare system in this country, which most of us are aware of has a lot of shortcomings. And misdiagnosis, medical errors is part of that. People who are involved in healthcare who are not caring is part of that. And so the story kind of has a happy ending because the series of second opinions and third, fourth, and fifth second opinions that I got all concurred that this was not a sign that I had cancer in my brainstem. It was a side effect from the radiation.
Makes sense.
And so I relaxed, and the people who cared about me relaxed. And, I did decide to take a year's worth of immunotherapy as kind of added protection to make sure that if there were any cancer cells left, that they would probably be gone after a year of immunotherapy. And there was a particular drug that was just approved for cutaneous squamous cell carcinoma called cemiplimab that I got as infusions every 3 weeks for 1 year. And I just finished that in September. So I feel like I'm pretty much immunized against any more skin cancers at this point for at least a period of time, because even my skin and my incidence of precancers and basal cell cancers and squamous cell cancers has decreased during this past year because I've had this immunotherapy kind of unleashing the power of my immune system to seek out and destroy any cancer cells in my skin. So that is basically my journey. And I think it's instructive, not only to share with patients and other people who have cancer and other serious life-threatening diseases, but also for my colleagues. And I want to encourage naturopathic physicians in particular, especially those of us who specialize in oncology, to take an active role in helping their patients to get through the health system as smoothly as possible for their care, because there's a lot of uncaring, unfortunately, I think, that we encounter as patients when we have cancer and other serious illnesses.
Thank you, Michael, for sharing that, for sharing your story, and for your insights in the process. And I'm so happy for you to be on this side of it, of course, and to be able to. Do you feel like you have did it shift at all your view of like, what are you going to do with your life now?
Yeah, I would say it really helped to motivate me towards self-care in a way that I had not been motivated enough before. Like you, I've devoted a lot of my life, my time, my financial well-being to supporting our profession and other related integrative medicine organizations. And about 3 years ago, I served on the boards of about 20 different organizations. And my friends thought I was crazy. And, when I had never counted them all up, but when I sat down and counted them all up, because one of my friends wanted to know, how many boards are you really on? I was, stunned. And so little by little, I started disengaging from these voluntary obligations and spending more time, taking care of myself, spending time with my spiritual practice, with reading, with I'm a triathlete, so I was training for triathlons, and I think I got myself into a position where I'm healthier now than I was, at the time of my diagnosis with cancer, because it really, was a wake-up call for me, as it is for a lot of people, to change the things in my lifestyle that were not conducive to my own health and well-being.
Mm-hmm. Yeah, it makes you just really look at it and reprioritize, right? And be like,
right.
What am I doing with my time and my energy and my skills? For sure.
Right.
I mean, and I think you're, even from the beginning of what you shared with us, you're a giving person. You see when something could be different and you want to get involved and help. So I think a lot of people could relate to that. If we're a person who's wanting to help, but how do you then choose to make sure you're helping yourself enough also? It's a really hard thing to learn and do.
Right. Yeah. Yeah. I was talking with my therapist a couple of years ago, and although I've seen her for quite a while, she asked me about my family of origin and where I was in the birth order and everything like that. And I told her I was the oldest of 5, and she said, "Oh, that makes a lot of sense. That's why you've been taking care of people all your life, because from the time you were young, you were responsible for helping your mother take care of your younger siblings." And I said, yeah, that's definitely true. And it does explain a lot of my behavior in life, to try to, make the planet a better place for other people and help people out in need. Yeah.
Mm-hmm. And it's such a beautiful thing. And I hear you still want to help people even in their healthcare process, but now you're like, okay, how can I also help myself? And you're so resourceful, like that's a lot of what I hear in your medical processes, constantly being willing to think about, like, if we think about just like if a person was just starting in a medical process of needing to get something diagnosed and going through imaging and deciding how they wanted to treat it, what would you, I'm trying to look at this, what you did, like when you stopped the doctor who wanted to just treat the lesion before diagnosing it, and you thought to yourself, no, I want to biopsy, which is just a simple, different thing to do, but it was, you stopped the decision-making process and you said, no, I want to do something different. Now, a lot of times people may not feel confident saying that to their practitioner, but maybe from listening to this, they might feel a little more comfortable saying, hey, doc, is there anything else we can do before? Or tell me, what would you suggest for people?
Well, as doctors, we are actually responsible for not only making recommendations about what we think is in the best interest of our patient, but also letting them know what their other options are if they're not our recommendations, and what the benefits and risks of our recommended treatment plan is, and what the benefits and risk of other therapeutic options are. It's basically the principle of informed consent. And so I think that in the haste of medical practice, it's often kind of overlooked, and you're handed a form to sign, and it's got, it's 2 or 3 pages long, and in the fine print it says, one of the risks of this is that you could die from this procedure, and you're expected to just kind of like speed read it and sign it and give it back, rather than there being a thorough, thoughtful discussion of all of the various options. An example would be that I'm a naturopathic physician. I'm not an acupuncturist. I understand the value of acupuncture, but I don't do it. And so it's not something that I often recommend, but it's something that I probably should recommend to my patients, because acupuncture is really valuable treatment. And I should let them know that that's another option besides what I'm doing.
Mm-hmm. Mm-hmm. Yeah, it's true. But it's even sometimes it's a matter of time and a matter of just having space for those conversations, and you're really pointing out, hey, this is a valuable conversation we should make space for before we proceed with any treatment or protocol.
Right.
I'm curious, like, just from everything, your expertise in dermatology, even before you've experienced these dermatological conditions yourself, what do you recommend for someone when they're watching their skin, for potential lesions? What did you learn something new that you didn't know already? Or is there anything that you're like, if you see this, you should definitely have it checked out?
The main lesson that I learned from this experience with my dermatologist was not only to question what she was recommending, but to know what it is that's being treated, to identify, to make a diagnosis and then treat, but not to treat something without knowing what it is.
Know what it is.
Yeah.
But when people say, a lot of people have probably lesions on their face, what should they be looking for where they should even go in and have it diagnosed?
Well, I think almost every human being should have an annual skin check. Even if you got perfect skin, you could have a skin cancer someplace that you can't see, like, someplace on your back that you don't see, or that you can't reach. You have no idea that it's there. Mm-hmm. And so skin cancer is, something that should be part of our emphasis on preventive medicine, skin checks. And so when you get a skin check, I think it should be from a highly experienced dermatologist, preferably, who does a skin check from your head to your toe. And, you undress, they look everywhere. And then you go back a year later and they have like photographs and written records of what was there the previous year, and they make a comparison. And that's how, we should best be, evaluated on an ongoing basis, I think, for abnormal skin conditions, especially skin cancer.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
Well, luckily you were fine. I mean, I have to think if it wasn't for your interest in dermatology and your background, you might have even noticed this lesion in time.
Yeah. I mean, at the time that she wanted the treatment, it wasn't something that was bothering me. It wasn't something I had necessarily noticed. She found it on an annual skin check and she said, why don't we just take that off? And, she wanted to laser it, which would have meant that there would not have been a biopsy specimen. It would have just been vaporized and we would have never known. And the cancer had already spread to the nerve. And who knows what would have happened if she had done that. I might be in bad shape.
Wow. So it's just, reminding everybody, like, it's good to do the annual because you may not have even realized it's happening on your skin. And it's not just on the face. It could be anywhere.
Right. Right.
Wow.
Yeah.
Wow. Thank you so much. I mean, I think it's so insightful. And as you know, this past year, you and I had kind of a parallel process. I was going through diagnostic process myself this past year. It's so interesting that we had that in parallel, and mine turned out to be not malignant. It is a benign sort of acellular unknown growth, but it meant that I needed to enter into this diagnostic process. And I agree with you, like, over all these years of helping patients, I don't think I fully understood the challenges of that process in the medical system. First of all, just, trying to find the right specialist that matches up with your insurance plan already is difficult, because the insurance plan determines a lot. Like, I went to the closest facility to me, which is only like 5 minutes away, but they aren't covered by my health insurance. So I had to I paid that doctor out of pocket anyway, because I wanted his insights and his opinion. So I paid him out of pocket. And then he gave me the name of the thoracic, this is a thoracic surgeon. He gave me the name of his mentor, thoracic surgeon in Manhattan at Mount Sinai, who was under my insurance. And so I've been traveling into Manhattan. That's, at least an hour and a half each way to be able to see this specialist. But I'm so grateful because it makes all the difference to be working with a specialist who has, right, like this expertise, this experience, this ability and access to facilities and other treatments that maybe wouldn't be possible if you're just working with whoever, just any old practitioner. I mean, and I heard that in your story too, that you really sought out, okay, I'm going to go to this specialist. And so I think that's an important point maybe for people to hear, that it can be worth it, even if you have to drive further or make a few more phone calls. What do you think of that?
Oh, absolutely. Although I am a big advocate for people, especially with cancer, getting treated at home rather than traveling to Mexico or Germany, some foreign place where they don't know anybody. I think that having your support system around you is really important when you're dealing with cancer. But I do think that, having, consultations with, real experts, wherever they may be around the world, is a lot more feasible now that telehealth has become popular, and most, physicians are willing to do that. I had two interesting things happen when I was looking for other resources for my cancer diagnosis. One was at Mayo Clinic in Scottsdale, where I went through this whole interview on the phone with somebody taking all of my information. And at the very end, she says, "Oh, yeah, by the way, you've got Medicare. We don't take Medicare." And I went, "What? You're Mayo Clinic and you don't take Medicare?" And she said, "No. And we charge twice as much as Medicare pays for." So I just hang up. It's like that. This is ridiculous. And then I also contacted MD Anderson Medical Center in Houston, which is like the nation's largest medical center. And at the end of my interview there, I found out they don't do telehealth consultations. You have to go to Houston to get treated there. So, those things didn't work out for me because of, the distance and the fact that Mayo Scottsdale told me they didn't take Medicare, which was just unbelievable.
So I think that what that says to me is you kind of have to know going into it that you might have to invest some time, and because this information doesn't always happen in the first 5 minutes. Like, you have to make the time and go through the whole conversation and ask the questions until you're like, okay, is this actually going to be a fit? Or am I going to find out at some point in this conversation that it's not a good fit? And maybe you still get a little info from that.
Right.
And then be able to, because otherwise it can be frustrating. Like, I remember I just kept having to manage my own frustration level, oh my gosh, how much time am I going to have to spend? How many conversations am I going to have? And just kind of ahead of time being prepared for that, almost like just go, okay, this is the process that I'm in, like a project in some ways, like your own health project. And it's having the conversations is more important than the frustration that may come with it, and don't let that stop you.
Right. And this is why I think it's really important for us as naturopathic physicians to consider really taking the position of being an advocate for our patients, so that we can help them navigate their way through this and get a team of caregivers who are really caring, who are really experts, and a winning team.
Yeah, it's true. That team concept, I find, made a difference too. I mean, the other thing was I found with imaging, like if I went to an imaging center local to me, which might be more convenient and fast, then I had to go through all the effort and time to get those records transferred to the practitioner who needed to see the records. So then I would end up just figuring out, okay, maybe I'd rather just invest in driving to the imaging center that's going to be easier for my practitioner to access. And so just realizing sometimes you just have to kind of figure out weigh these out and go, what's the best way to get this imaging done? Or there was a lot of also some kinds of imaging requires you have certain testing ahead of time, especially right now, COVID testing. I would have to do COVID test and then sometimes blood tests or anything else as a prerequisite to going in for, because I had to do 2 essentially lung biopsies. They weren't actually biopsying my lung, they were biopsying right next to my lung. But when you do a biopsy in the thoracic area, you have to go through the same procedure as a lung biopsy, which requires also chest X-ray, COVID testing, blood testing. And so I had to go through all of that twice. And it's just to know okay, this is going to be something where you're going to want to, set the day up, do your self-care as part of that, right? I started realizing I need to go to bed in time. I need to figure out what I'm going to eat, make sure you have someone who can be there to bring you or pick you up, and support yourself through the diagnostic process, because it can be a long and, stressful process.
Yeah. The erroneous reading of the MRI that I had done on the other side of the island because I was told that the MRI over there was better. So I made a 2-hour drive over there to get an MRI that was not read properly by the radiologist. And subsequently, I didn't want to go back there, of course. I've had all of my follow-up MRIs, which have been, I probably had 5 now, done over in Honolulu, which requires me getting on an airplane and going over there and renting a car. And, but there's an MRI center over there, and that's all they do is MRIs. And the radiologist is highly experienced and much better than anybody we have on this island. So, yeah, sometimes I think it is better to, take the time to travel to get the best care.
Yeah, and to get the imaging from the person who can really interpret it and get it easily. Yeah, would have not known that before, know. So it's such a good point to, that as naturopathic doctors, we can, help people now to be like, okay, this is, and how to kind of keep your mind in the game. I mean, you talked about being a triathlete. I'm not a triathlete, but I have to think that a lot of times I make the analogy, I don't know if I'm being correct, Michael, you have to tell me, but I often say to people, like, even if you're not going through a health diagnostic process, even just day-to-day life, if we think of it more like running a marathon, like when a person's running a marathon, they kind of anticipate they're going to need to drink some water. They're going to need to stop and go to the bathroom. They're going to need to fuel themselves in some various ways. They kind of expect it. They're going to need some sleep. They need some preparation, right? So when we think of running a marathon, we expect all of that. But when we think of doing our day-to-day life, let alone a diagnostic process, we think we're supposed to just be able to power through without feeding ourselves or enough sleep, or right? Like,
yeah, absolutely. Yeah, I use that analogy too. In some ways, dealing with any serious health condition is like a marathon. And there may be times during the marathon where you feel that the wheels are coming off and you feel horrible, and you just have to keep your head down and keep going, or you need to take a break or slow down or, something. And then there are other times where you kind of get a second win and you bounce back and you're feeling good again. And so I think the analogy is a very good one. I think in some ways life is like a marathon because there's lots of ups and downs and challenges and setbacks that we have to contend with.
Mm-hmm. Yeah. And to, just that, I know you have a lot of background in meditation. That's one of the things you and I have always enjoyed talking about. Did you use that during this time? Do you feel like that made a difference for you? Absolutely.
It kind of began when I needed to have an MRI, and you're in this closed, container, and you can't move, and you've got to just relax and let it happen. And they take about 30 minutes. So I just meditated and I was fine. It was no issue for me. And then when I would have a radiation treatment, it was, for the left side of my face. And I had to be in this stereotactic device where they put this plastic like helmet over me and fastened me to the table so I couldn't move a centimeter. And it was uncomfortable. There was a mouthpiece that didn't fit in my mouth just right. And so I really had to just kind of breathe and relax and kind of accept it and make friends with, this device that was, trying to help me. And so I had that to deal with. And then I read a really, really good book during that time also called In Love with the World, that was written by a Buddhist monk, Tibetan Buddhist monk, who was sort of like the Buddha himself in that he had had a very privileged childhood and early life and lived in a monastery, and he really hadn't had much contact with the outer world. And he decided, like the Buddha did, to leave the monastery, leave his family, leave everything behind and kind of sneak away and go check out the outer world. And this was in India. And so he experienced what it was like traveling on train with, people who were very poor and it wasn't very a hygienic situation. It was noisy and chaotic, and living on the streets and, running out of food and drinking bad water and getting sick. He got really, really, really sick to the point where he was so dehydrated, he was almost dying. He was dying. And he was basically unconscious, and someone found him and took him to a hospital. So he survived, and he wrote about his experience. And it was a really good description in easy to understand language of what is really in Buddhist philosophy about dying and making friends with death and being so grateful and so in love with the world that we have to live in, if we're not dying, even though we are all dying, a long process of dying throughout our lives. But that was a really, really helpful book to read to help me kind of navigate through those chaotic waters and to approach the possibility of death with a lot more peace and acceptance and friendship.
Mm-hmm. Oh, wow. Thank you so much. That's so amazing. And I also hear and see that you maybe that ability to, because with meditation, I think of it as like so much of an ability to observe our thoughts and experience, but not be so identified with it, be able to create a little space and be like, oh, let me observe this possibility of death without being in a reactive state of fear. But what I also see is that you not only did you entertain this possibility of death, but you also were entertaining the possibility of living and how to kind of balance that and be in that unknown, right? It's about being you talked about being in the unknown for 2 weeks, but ultimately you were in the unknown for much longer than that, because not knowing how the treatment was going to go. So you're in this unknown for a long period of time. And I have to think that your practice of meditation would have helped you kind of being in there like, hey, how do I support the possibility that this is going to be successful and I'm going to survive? And how do I support the possibility that this might be the end of my life? And what does that look like?
Mm-hmm. That's right. Yeah, I mean, I think you hit the nail on the head that really what meditation is disidentifying, with our egoic nature and realizing that a lot of our mental processes are just stories that we tell ourselves over and over and over again. And if you can get some distance between the machinations of the mind and what our true nature as a human being really is, we can see that a lot of what we tell ourselves, a lot of the stories that we tell ourselves are not real and that they're not helpful and they may be unhelpful.
Yeah. And to get this, it's such a sort of poignant time to get those kind of insights when we're in that process. I mean, I know for myself, I ended up getting so many insights about myself in the past year and insights about what was underlying, for me, what ended up to be a chronic inflammatory condition, for me, and as a naturopathic doctor, always asking why do I have a chronic inflammatory condition when I have spent my life, and especially the past 20 years, eating in a way and, walking my talk as a naturopathic doctor to reduce inflammation. I mean, now I look at it as, thank goodness, just like with you, thank goodness you were doing all the things you were doing to prevent this or, solve it as soon as possible. But at the same time, even as naturopathic doctors, sometimes these processes still happen because, of course, we're still living in human bodies, doing stuff that humans do to make us susceptible.
Yeah. Yeah. And the same is true even for highly advanced spiritual beings, monks and spiritual teachers, they don't live forever. They get sick and die too.
Here we are. Oh my gosh.
But this reminds me of the story I wanted to share about when we met.
Yes.
Because I recall it was in a restaurant downstairs from an art gallery that belonged to a mutual friend of ours who introduced us. And that as I got to know you over that meal, it seemed to me that I really wanted to invite you to join the National Board of Directors, our national organization's board, because you were already so engaged in the profession. You were already trying to get a license for naturopathic medicine in New York City. And I just thought that you would be a real asset. And I kept asking you if you would do this, if you would do that. And then just kind of jokingly, you were saying yes to all these things. I said, will you marry me, Doni? And you said, no, I can't. I'm already married.
One thing like I was found to say no to. And now, yeah, like I that's the thing. Sometimes it's so easy to say yes, right? Especially when it's like,
yeah. And both of us have been saying yes far too much for far too long in our lives. And I think we've both kind of woken up here in the last couple of years. And now we are seeing that, our constant yes saying has been, counterproductive to us. It's been too extreme and, not in our best interest to have done that much. So, we have to disengage from, organizations that, can get along without us, and to, be satisfied with what we already have done rather than feeling like we have to do more, to disengage from relationships that aren't healthy, and, spend time with people who really support us and love us and inspire us.
I love that. Thank you, Michael. Yeah, I completely agree. And I think a lot of people could relate to that. It's hard to learn how to say no, but to realize, wow, by saying no to something that maybe, we would love to say yes. But when we look at the whole picture, it's like, actually, when I look at my schedule and my priorities, I'm not able to say yes to everything. We need to be able to learn how to say no.
Right.
Well,
yeah. Saying no sometimes means saying yes to oneself.
I love that.
To taking care of oneself. Yeah.
Thank you so much, Michael. I think this is really gonna, be amazing for listeners. And I'd love any of you who are listening, if you have comments or feedback, please send it to me or like and share this conversation. And Michael, if someone would like to be in touch with you, how best to reach you?
My email is very simple. It's Traub, Traub, .michael@gmail.com.
Okay. All right. And I'll put this in the show notes too, so they can find you and connect with you and because you're still practicing some.
Yeah. So I see patients 3 days a week. I do a lot of telehealth as well as in-person care. So
if you're, looking for someone with especially this expertise, but oh my gosh, I know Michael has expertise in way more than dermatology and oncology, but if you're looking for assistance, thank you, Michael, for being available for them to reach out to you. And and oh my gosh, I feel so grateful again. I mean, I don't even know how to express the gratitude for someone as like you in life, that's just, like you said, we met and we just, you realize this is someone who you can really connect with and grow with and learn from. And you and I have gotten to do so many exciting things together over the years in terms of, speaking together and working together on other projects as well. So I just want to express my gratitude just for this conversation as well. So thank you, Michael.
My pleasure.
All right, everyone. Well, thanks for listening in, and I'll look forward to connecting with you very soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.